In Part 2, we saw how plaque forms. In Part 3, we learned how to measure risk. Now we answer the next question. What actually happens when an artery suddenly closes? The process was silent for years, but the event itself can happen in minutes. This is the transition from risk to emergency. Inside the artery, a thin fibrous cap covers plaque. If inflammation weakens this cap, it can crack, not dramatically, not visibly from outside, just a small rupture inside the vessel wall. But that small rupture changes everything. When the cap ruptures, the body reacts instantly. It thinks there is injury. Platelets rush to the area. They stick together. A clot begins forming. Normally, clots stop bleeding. But here, there is no external wound. The clot forms inside the artery. As the clot grows, blood flow decreases. The artery narrows rapidly. Then suddenly, flow may stop completely. The heart muscle beyond that point no longer receives oxygen, and heart muscle cannot survive long. Without oxygen, heart muscle cells require constant oxygen. Without it, energy production stops. Cells begin to fail. Electrical signals become unstable. Pain signals activate. If oxygen is not restored quickly, cells begin to die. This is not symbolic damage. It is biological death. Doctors say, time is muscle. The longer the blockage remains, the more muscle is lost. Minutes matter, not hours. Early reopening can save tissue. Delay increases permanent damage. This is why speed changes outcomes. As muscle suffers, the body sends signals. Chest pressure, tightness, heaviness. Sometimes pain spreads to arm or jaw, but not always. Some heart attacks present quietly, which makes awareness critical. Not every blockage is complete. Sometimes an artery is only partially narrowed. Blood can still pass through, but during effort, the heart needs more oxygen, and that narrowed vessel cannot deliver enough. This condition is called stable angina. When a person walks fast or climbs stairs, the heart works harder. It demands more oxygen. If supply cannot increase, chest discomfort appears. But when the person rests, demand falls. Oxygen supply becomes enough again, and the pain improves. That pattern is typical angina. A heart attack is different. Here, the artery becomes fully blocked. Blood flow stops completely. Rest does not help. The muscle beyond the blockage receives no oxygen at all, and the damage continues until flow is restored. When cells are deprived of oxygen, they release distress chemicals. These chemicals stimulate nerves. The brain interprets this as pressure or crushing pain. Because the blockage remains, the signals continue. That is why heart attack pain does not go away with rest. The most common symptom is chest pressure, not always sharp pain, often described as heaviness, tightness, or squeezing. Many people say it feels like a weight on the chest. Pain may spread to the left arm, to the jaw, to the neck, sometimes to the back. This is called radiation. The heart and these areas share nerve pathways, so the brain projects the pain to multiple regions. Not every heart attack looks dramatic. Some people feel only fatigue, or breathlessness, or mild discomfort. Women, older adults, and people with diabetes may have atypical symptoms. This is why awareness matters. If chest pressure lasts more than a few minutes or keeps returning, do not ignore it. If it comes with sweating, breathlessness, or nausea, seek help immediately. Do not wait for it to become unbearable. Early action can save heart muscle. The heart muscle begins suffering immediately. Within minutes, cells lose oxygen. Within an hour, damage expands. Every minute of delay increases tissue loss. That is why doctors repeat, time is muscle. Speed protects survival. In the ambulance, medical teams act quickly. They monitor blood pressure. They record an ECG. They give oxygen if needed. Sometimes medication to reduce clot growth. The goal is simple: keep the patient stable while reaching the hospital as fast as possible. An ECG records the heart's electrical signals. During a heart attack, these signals change. Doctors look for specific patterns. One important sign is ST elevation. It suggests a complete blockage. This guides Urgent treatment decisions. When heart muscle cells are damaged, they release proteins into the blood. One of these proteins is called troponin. A rising troponin level confirms muscle injury. It tells doctors that damage has already begun. To see the blockage directly, doctors perform angiography. A thin catheter is guided through a blood vessel to the heart. Contrast dye is injected. On the screen, the coronary arteries appear. The blocked segment becomes clearly visible. If a blockage is found, a balloon is inflated inside the artery. It pushes the clot against the vessel wall. Then a small metal mesh, called a stent, is placed. The stent keeps the artery open. Blood flow returns. Oxygen reaches the muscle again. Sometimes, a stent is not enough. If multiple arteries are severely blocked, doctors may perform bypass surgery. A healthy blood vessel from another part of the body is used to create a new path for blood flow. It literally bypasses the blocked segment. When blood flow is restored, oxygen returns to the muscle. Some cells recover quickly. Others, if deprived too long, are permanently damaged. This is why early treatment makes such a difference. Saved minutes means saved muscle. When heart muscle dies, it does not regenerate. Like skin, it is replaced by scar tissue. Scar tissue cannot contract. If the damaged area is small, the heart may function well. If large, pumping ability decreases. Recovery does not end at hospital discharge. Cardiac rehabilitation helps strengthen the heart safely. Supervised exercise, nutrition guidance, and education reduce future risk. The heart can adapt, but it needs support and consistency. After a heart attack, medications are critical. Antiplatelets reduce clot formation. Statins lower cholesterol and stabilize plaque. Beta blockers reduce heart workload. ACE inhibitors protect heart function. These medicines are not temporary. They are protective tools. A heart attack is not only physical. It can create anxiety, fear of recurrence, uncertainty about the future. Emotional recovery is as important as physical healing. Support systems and counseling can make a difference. A heart attack is not a sudden accident. It is the final stage of a long biological process. Plaque builds, risk increases, a rupture happens, a clot forms. But understanding this chain gives you power. When you know how it happens, you can act earlier. You can prevent damage. You can protect your heart. If this series is helping you understand complex things simply, please like the video. It helps this information reach more people. Subscribe to the channel because the next part focuses entirely on prevention. Missing it may break the flow of understanding. And share this with someone you care about because awareness can truly save lives.